It's really important to keep your braces intact throughout treatment. For every bracket that you break, you add about a month onto your treatment. Avoid hard, sticky or chewy foods.
I'm going to chat to you about a few things that you're likely to experience as you start things. It's quite normal to experience a little bit of discomfort. If you do happen to do that, just take what you would for a headache, so Nurofen or Panadol, and that should generally settle within about a week or so. The other thing that you can experience in association with your braces is a little bit of soreness on the insides of your cheeks. Your cheeks aren't used to having something as hard as a bracket wrapping up against them, so what can happen is that you can get a little bit of an ulcer developing. In order to stop that from happening, we're actually going to provide you with some wax. Inside your banding bag, you'll find this little packet. For the next week or so, it'll probably be your best friend. We want you to take it everywhere you go. What you do is you actually just grab a little piece of this wax out of your packet, work out which bracket is causing the soreness. So for example, if it's this one here, we would get you to just dry it a little bit with a tissue or something like that to make sure that the bracket's dry. That way your wax will stick better. We get you to roll it around into a little ball and just press it over the bracket. And what we get you to do is leave that there the whole time while you're eating, drinking, sleeping. The idea is that your wax is there to protect your cheek and give it a little bit of a rest. We get you to just remove it when you're going to brush your teeth, and that's just as simple as peeling it back off like that. The other place where your wax is useful is just at the very back bracket here. You might find you get a little bit of wire poking out as you move through the weeks in between adjustments. What we get you to do is actually just place your wax there, but also give our office a call. We have appointments available almost every day just to trim that little bit of wire, make you comfortable, so you don't need to wait to your next appointment to get that sorted for you. Good idea to actually take your wax with you wherever you go, as I mentioned. Sometimes when you're eating, you might actually swallow your wax. Don't be worried, but also just notice it's gone and replace it. Eventually, over time, your cheek will toughen up and you won't need to place the wax there anymore. The next thing I'm actually going to talk to you about is the cleaning side of things, so that's super important. We want you to keep things nice and healthy in there so that the teeth have the best opportunity to move into position. We're going to actually provide you with an electric toothbrush because we feel they do the best job in terms of helping you clean your teeth thoroughly. They actually do a circular motion, which is great in getting rid of plaque, so we're going to go through the steps to make sure that you do the best job. So basically what we're going to do, we have our toothbrush and we get you to break the teeth into thirds so that you don't miss any areas. We get you to start with the gums and the top part of the tooth, then we get you to come back and angle the brush down to get the other side, and then come back and angle the brush up to get the underside. Basically with the first step, we get you to use your brush and we get you to rock backwards and forwards on each tooth. So the reason that we do that is just so that we don't miss any areas, because our teeth are contoured, they're not flat. So if we were to do this, we would miss all the areas in between. By doing this, you're actually going to make sure that you're going to get to every area, and concentrating on your gums in this step is very important. If you find that your gums start to bleed or become a little bit puffy, it just means that you might have missed brushing there for a couple of days in a row and the plaque is making your gums a little irritated. You'll find that if you concentrate on the brushing, that things will return to normal quite quickly. So once you've completed that first step, we get you to come back and we get you to angle the brush down. You're actually going to be doing that same rocking motion just to make sure that you're going to get rid of any plaque. So rocking backwards and forwards, tooth to tooth, and continuing that around. Once you've done that, you come back and you angle your brush upwards and doing the same thing, just so that you're going to get the underside of the brackets and the wires. Also, don't forget your biting surfaces and the inside parts of the gums and the teeth. And then you would repeat that on the lower arch. The other thing that you can still do while you are in braces is flossing. Flossing is the only thing that cleans in between the teeth, so we'd encourage you to try and build that into your routine. The only thing that you will need to do is actually just thread the floss in between the wire so that you can gain access to the insides of the teeth. Okay, we'll try and get you to do that at least 2 to 3 times a week. If you find with your normal floss that it is a little bit hard, you can actually get from the chemist something called Super Floss, or also on our online shop. It has a stiff nylon end which makes the threading a little bit easier. Also on your brushing, we're actually going to provide you with something called a little pixter. In your banding bag, you will find a little yellow envelope and the pixter will be in there. This is something that we encourage you to take with you wherever you go, so that if you're eating something, what we get you to do and it gets caught in there, we get you to just go in behind, and that can actually get rid of any food that's left there. So that's quite handy for you if you're at school or at work. No need to take your brush with you everywhere you go, you just need your little pixter. These are reusable, so you just rinse them under some water, pop the lid back on, and they're good to go again. The next thing that we will get you to do is at the end of every day after you brush your teeth thoroughly in the night, we'll get you to just go behind each wire and around each bracket quite thoroughly. It's quite a quick process, but we do notice that it makes a difference in keeping things nice and clean in there. Once this looks like it's not doing its job anymore, you can actually purchase it in our online shop or at the supermarket, just where you would buy your toothbrushes. We're getting you to actually brush your teeth twice a day really thoroughly and setting aside about 5 minutes a day, just to make sure that you're actually not going to be rushing things and making sure that the process is carried out thoroughly. The other thing that we will get you to do, which you will find in your little yellow envelope, is once you've actually gotten used to your new brushing routine, so in a couple of weeks' time, we'll get you to actually just test how well your brushing is going. So you'll find a little pink tablet in there along with some instructions, and basically this is going to see how well you're brushing. So at night time, once you've done your thorough brush, we'd get you to actually chew this up, rinse out with some cold water, and have a look in the mirror. And anywhere that you've missed brushing will be this bright pink colour. This actually indicates that you've actually left some plaque behind, and it's just a great visual for you to actually have a look and see where you might need to concentrate brushing a little bit more. These are also available in our online shop. The other thing that I will chat to you about too is just the sorts of foods that we'd like you to avoid, or maybe just change how you eat them now you have your braces. Obviously what we're going to get you to do is just use your common sense. So try and avoid things that are really hard, really sticky and really chewy. We have a full list of foods that you should avoid on our website under our patient resources tab, but basically it is just about modifying things. For the first few days we'd suggest you stick to some softer foods just to sort of get used to how things feel in your mouth now that you've actually got your braces on, and then gradually just modifying the diet. So for example, you can still have an apple, but you just won't be able to crunch into it the way you used to. You'll need to actually just slice it up. Things like corn on the cob, same thing. Won't be able to bite into them, but you can still have the corn as long as you cut it off your kernels. And then also things like, say, tacos, maybe stick to some wrap style tacos rather than the hard shell tacos. So you can see it is quite easy to adapt to actually life with braces. Maybe make a big list of the things that you can't eat while you have them on, things like red skins, really chewy sort of lollies and things like that we wouldn't recommend. Maybe make a celebration list, and that at the end you can have a big party. If you do happen to break a bracket, it's not an emergency, but we just want you to contact our office as soon as possible. Letting us know what is broken and being able to inform our receptionists with as much detail as possible is very helpful. That allows them to book the right appointment for you. In terms of what you have on in your mouth, the braces are composed of 3 parts. So you have your bracket, which is the part that's stuck onto the tooth. You have a wire which runs through the braces, and then you also have these modules. So sometimes they're coloured, sometimes they're clear, that's up to you, and you get to have lots of fun with that. But the little module or elastic ties the bracket and the wire together. So basically what we need you to be specific with is if it is a bracket that's broken, we need you to let reception know. They need to actually book a time when our doctor is here to place that to his prescription. Anything else, so if it happens to be a wire that's poking in or one of your colours have come off, then our hygienists are able to fix that every day for you. Next, I'm going to talk about protecting your braces. So if you happen to play a contact sport where you might be likely to get a ball or a kick or something to the mouth, we suggest that you actually use one of our mouth guards, which we will provide. These are actually just very stretchy and easy to pop in the mouth. They have quite a wide channel, so that allows for the teeth to continue to move into position, and you are able to talk with them to your teammates while you have them in your mouth. So just let us know, if you need to actually have one of these, if throughout your treatment you actually take up a sport or something like that, let us know and we can provide you with one of these if we haven't already done so today. The other thing that I'll show you too is if you happen to play a musical instrument with your mouth, we can provide you with these things called comfort covers, which actually just pop over your brackets and make it a little bit easier to blow onto your instrument. So just keep us informed with that as well. And the last thing I'll chat to you about is obviously just keeping up regular visits with your general dentist. We recommend 6 monthly cleans while you have your braces on, just to make sure that things are nice and healthy in there. And our receptionist will actually be mailing you or contacting you in regards to that, just to remind you that 6 months has passed and it's time to check up with your general dentist.